Hello, this is a bioenergetic exercise that will help you to learn the suggestion or stitch from the bucket and the stone. I will read to you while you try this yourselves from both the Bioenergetics book as well as my own. Put your hands together, let the heels and the center of the hands come apart. You'll then face your fingers towards your chest. You're either sitting in the easy pose that we've done, or you're standing in one of the three poses, or you're sitting on a chair like I am. Move the hands away from the body until you feel that energy. You can see mine a little bit actually. I'm pulling my head up towards the ceiling, my chin in a little bit, my chest is relaxed. I'm breathing into my guts and I'm holding this while I read to you. This is from the Bioenergetics book by Dr. Lowen. The mind can direct a person's attention either inward or outwards, toward the body or toward external objects. In effect, one focuses one's energy either on the self or on the external world. A healthy person can alternate between the 2 points of focus easily and rapidly, so that most of the time one is aware of one's bodily self, right? Your hands are shaking a bit, and of the environment. You can watch yourself doing this with your hands. Such a person is mindful of what is happening to himself as well as what is happening to others. But not everyone has this ability. Some people become too mindful of themselves and develop embarrassing self-consciousness. Others are mindful of what's going on around them. You could have been mindful of the sounds that were going on in the street as they went by. I call it seeing with two different eyes from the bucket and the stone. The bucket and the stone. Duality, right? Two different eyes. In my early portraits, there were two different eyes. Now I see that this references the two ways of seeing. We can be in a situation, engaged in conversation and doing, and also mentally step back and assess the situation. This duality encompasses being engaged in the situation and also silently viewing the situation you are in. I taught myself to perform this dual action through art. In early lessons, I laid on the floor and meditated and then stood to paint or draw the image. Later, I stood with eyes open and created while I was in the work and also able to step back mentally for a compositional structure. The ability to be somewhere and also to view your situation is paramount. I consider this duality part of being the present tense. You're aware enough to bring yourself back to listening through viewing if you drop out or lose yourself to emotions or thoughts. Present tense is being both engaged and listening and engaged and viewing. You are engaged in present tense while you are aware of yourself, surroundings, and situations. The multiple levels of being or multiple levels of conversation are similar to multiple levels of the worlds that you are in. This Histalshalus, a Kabbalah or a Hasidus language term of the moment, is an extended or vibrant way of being. So bioenergetics actually also talks about vibrancy, and the action from this stitch or suggestion 29 is the next conversation you're in is to truly engage, listen and respond, and then see yourself in the situation. I can be present in this video and feel what I'm feeling. Obviously it's more of a transparent feeling, right? And then I can see what I'm doing, and you can see the difference, right? Where I'm watching myself in the video and I'm making sure that I look okay. But there's the feeling where I can go back into myself, and then there's the viewing. So it's both things. And this skill is also very important for some of the EMDR work that we'll do, or the bilateral tapping. If you can be present with a soft focus in the room and know where you are in a safe space, you can also witness, like a movie, the feelings that you have caught inside of your body. So this is an important stitch. This is an important suggestion from both, from all places, right? Any type of meditation, any type of bioenergetics, my book, The Bucket and the Stone, and EMDR. Take care.